Okay, thank you, Jeff. So I'm John McDermott. I'm the director of the CGR Research Program on Agriculture for Nutrition and Health. And I have a background in kind of agriculture and also in public health. So I think that's why I am where I am, and I've worked in management for some time. I'm going to share a bit with you, I guess, some true confessions of kind of why we're having this and why I think it's important. But first I want to acknowledge a couple of key people, and they're here. So one is, we're trying to really connect up between nutrition and health in a lot of our systems research, and Bioversity is engaged in all of those, so they're a key connector. So I'm glad, Anne, that you've come. And for many years, the CGR has been working closely with IDRC. And in fact, when we talked about developing this, it was kind of co-branded between IDRC and A4NH, and I'm pleased that Francois is here to give us that perspective. And throughout the conference, you're going to hear how kind of important nutrition and health is in resilience and how embedded it is in these systems. So we'll get that complication, but one of the things I'm struggling with as the director and why we're kind of actively exploring what to do is, how is it that we engage in systems with local communities moving forward to bring together nutrition and health, which is just one element of much broader livelihood strategies. So this is kind of how the challenge we have, and I'm sure there are better and worse ways of doing this. And they're going to have biological dimensions, ecological dimensions, social dimensions, economic dimensions. So I'm hoping that a lot of those things come up as we discuss. And my biggest issue is kind of, how do we do this? What are the key partnerships? I know that I need to work with people on the research side who have a strong trust relationship with communities, or it's not going to work. And I think you'll see examples in this conference of where they are, but this is a very nice mix. But I think, to me, that's a central issue. And I want to work with research teams that also have that relationship with communities, or with people who work with communities that have that trust relationship. So that's going to be quite important. So I just kind of wanted to lay out kind of why we're having this consultation the way we are, that we really want to move forward and develop this actively in the next year. And then in terms of our program, we have a kind of 2-year extension phase where we can actively develop this, and I hope make it a much bigger thing in the second phase of the CRP. So that's it from me, Jen.